you're joining us for the first time, maybe you're wondering what SIHI is and what SIHI Talks is all about. We are the Social Innovation and Health Initiative, SIHI for short, pronounced as SIHI, which means upward and forward looking. SIHI is a global network of passionate individuals and institutions who dream of a healthier and more equitable world through social innovation. Since 2014, we have been advancing social innovation in health through research, capacity building, and advocacy. We currently have 13 country research hubs in Africa, Asia, Latin America, and the Caribbean, and Europe. SIHI Talks is a series of monthly webinars that we hold to provide a platform for potential and current partners to connect and find opportunities to collaborate. Welcome! We're glad that you could join another conversation on social innovation today.
Okay, good morning, good afternoon, good evening, everyone. So, welcome and thank you for joining us today here on Zoom, as well as to everyone tuning in to our live streams on YouTube and Facebook. So, my name is Michelle, and I am joining you from SIHI Secretariat. We are delighted to have participants joining us from across the globe, including colleagues from our SIHI hubs, partner organizations, and the broader social innovation and health community. So, thank you for taking the time to be with us, whether it is afternoon, evening, or another time of day, wherever you are joining us. So, before we begin, we would love to know who is with us today. So, please feel free to introduce yourself in the chat by sharing your name, organization, and the country you're joining from. So, we also encourage you to use the chat throughout the session to share your reflection, comments, and questions. So now just a few housekeeping reminders to help ensure a smooth session for everyone. So we will have a time for questions and discussions later in the program after our speaker's presentation. But you are welcome to post your questions or insights in the chat at any point during the presentation. So if you experience any technical difficulties during the session, please send a message in the chat and a member of the SIHI Secretariat team will be happy to assist you. And lastly, please note that this session is being recorded and live streamed on our official YouTube and Facebook channels. The recording will also be made available afterwards for those who wish to revisit today's session. So to officially open today's program, it is my pleasure to invite Dr. Pamela Pasco, who will introduce the SIHI Philippines Hub and our distinguished speaker. So Pam, the floor is yours. So let's just wait for a few minutes for Pam. I think she just got disconnected for a minute. I think Pam is having some technical difficulties with the internet connection. So we could proceed now to Nisha's presentation. So I'll just introduce Nisha for you guys. So Nisha is a graduate with a master's in global health and health promotion and education, with a previous academic background in the social sciences. Her work was primarily focused on implementation science and child and adolescent health. She is passionate about community engagement and committed to promoting health equity through collaborative, culturally responsive, and evidence-informed approaches. So, now I'll give the floor to Nisha.
Yes, thank you, Michelle, for introducing me. And hello, everyone, and thank you for joining me today for the SIHI talk. I will share my screen. All right. Um, can you see my screen?
I think it's still loading.
No?
So it's indicated that it's pause screen sharing.
Mm, Let me try again. Can you see my screen now?
Yes, but I think it's on the speaker's
Oh,
notes. Yeah,
sorry. Um, wait, 1 second.
no worries.
All right. What about now? Can you see my screen?
Yes,
Okay. Is it still on speaker's notes or the
it's
full?
good to go.
It's good to go? Okay,
Yeah.
perfect. Okay, thank you for your patience, everyone. Okay, so hello, everyone, and thank you for inviting me to speak today at the SIHI Talk. I'm very excited to share some of the reflections that I made upon my stay in the Philippines and just my general experience of what it was like to be a SIHI fellow. So, as Michelle already mentioned, I have a background in health promotion and education. And the reason why I ended up with SIHI is because I wanted to gain some field experience in community engagement, especially in a low and middle income country, as part of my global health studies. Because I fundamentally believe that it is always one thing to read about effective community engagement and involvement, but it's a completely different story in terms of how we implement it, right? And since we know that communities can be these intrinsically complex social groups where a myriad of factors are at play that can impact their health, it is not only crucial to understand how we can work with communities, but also how we can empower them to reach better health equity. So, with this motive, I reached out to TDR saying, hey, this is something I would like to do. And eventually, they connected me with SIHI. And to be completely honest, I didn't really know what social innovations and health were in the beginning, but I was glad that I got connected with SIHI because it taught me a lot about what social innovations and health are and how the hub has contributed towards the development in the Philippines. So without further ado, let's just dive into my presentation where I will be sharing my reflections as a SIHI intern. All right. So, as you probably know, these are the four focus areas that SIHI Philippines focuses on. So, what they first try to do is that they try to identify and research about social innovations across the country. Second, they also try to strengthen capacity building, particularly for research and practice. They are strong advocates by connecting and convening different actors of within the social innovations and health ecosystem. And finally, they also work on knowledge translation. So how can we translate evidence into policy and practice? So, with this in mind, during my 3 month stay in the Philippines, I was lucky enough to participate in different activities that contributed towards advancing these objectives. And since their impact had not been evaluated yet from an external organizational perspective, this leads me to my following slide, which is the objective of my report. So I decided to investigate what is the role and impact of the Country Hub on the work and implementation of its social innovation, as well as how does it collaborate with different stakeholders, not only at a local level, but also national and international level. So this is an overview of the different activities which were under evaluation. So I was lucky enough to participate in different activities, but it's also important to note that since I was only there for about 3 months, this is more of a snapshot of the work that SIHI does. So it doesn't cover the full breadth of work that SIHI actually conducts, but this is something important to keep in mind whilst we go through my presentation, that it might not be fully representative of SIHI's work. Nevertheless, I did get to participate in different activities. I will just give a few examples for now. So to start with, I got to participate in human-centered design workshops. So here we introduced participants to concepts and processes of human-centered design, so co-creation methods, in the context of a community skin health program. The second is the AHEAD program. So this is a national initiative by the government that provides research grants for research that focuses on national health priorities. And then there's also the pilot testing of the HERE tool, where it's part of a larger study that looks at the interplay between social innovations and health equity. I'm not going to dive into all of the activities, but if you have any questions at the end with regards to the content or the process, please feel free to ask away. All right, so for the methodology of my report, the study design that I mainly employed was of qualitative nature. I adopted a participant observation approach, which means that participants' behaviors as well as interactions with the hub were observed in their natural context with little to no involvement. And the reason for this is because I was only there for 3 months, so the procedure to go through to obtain ethical approval would have been difficult in order to conduct in-depth interviews. But nevertheless, whenever the opportunities arose that I could interact with the innovators or with participants, I asked a few questions with their consent, of course. The settings were mainly in person as well as online. So not only were we based in Manila, but we also got to travel to other areas in the Philippines, such as Tarlac and Leyte. And the online meetings were primarily internal, so between SIHI team members, but also with stakeholders. I used a notebook and a computer to collect my data collection, and even though most people thought I was Filipino while I was there, this is not the case. I do not understand Tagalog, so I was lucky enough to have my team members to translate some of the documents for me, or just to give me a quick recap of the meetings and what was discussed there. Then for my data analysis, I primarily use a thematic semantic analysis using an inductive approach, meaning that the themes that I identify emerge from the data itself. So I didn't use a preliminary framework in order to analyze my data. However, I did use the Nesta framework to put my data into context. So this is the Nesta framework innovation spiral. So this delineates the different steps that innovations go through as they develop, right? So the first step is about opportunities and challenges. So here you really want to identify, okay, what can my innovation target? So what are challenges that my innovation could target? What is a possible opportunity for an innovation? The second step is more about generating ideas. So here you're already brainstorming different ideas. Then for the third step is when you start developing and testing. So you come up with different protocols to see what could work. The fourth step is about making the case. So here you have a definite innovation that you would like to deliver. And then that leads to the fifth step, which is about delivering and implementing the innovation. So delivering the innovation to the end users or stakeholders. Then the sixth step is about growing and scaling. So replicating this innovation throughout different regions or maybe other target users, etc. And then the seventh step is about changing the system. So how can you ensure that your innovation fits within existing structures? So how can you ensure that it's maintained and sustained over time? Now let's move forward to the most interesting part of this presentation, which is probably the results. So here I came up with 5 different themes. So there are communication, availability of resources, receptiveness by social innovators and stakeholders, connections and partnerships, and finally support for innovation development. So let's just dive into them. All right, so for the first theme, this is communication. So this reflects the general communication that occurred within the hub, but also between the hub and its social innovations and its stakeholders. This general theme can be divided into two subconstructs. So we have awareness and understandability. Awareness refers to whether participants have heard of SIHI before or were aware in general of the work that SIHI conducted. Understandability, on the other hand, reflects the extent to which the activities were comprehended by the participants, but also by the implementers. And what I noticed is that in most scenarios, participants were actually unaware of SIHI and the work that they conducted. For instance, in this picture, you can see a focus group discussion that occurred between an external evaluator with medical students at the University of Manila. And this was in the context of pilot testing an equity tool. And in this case, the participants were unaware of SIHI and what they did. This can be quite explanatory because, of course, in this scenario, the innovation had not been implemented yet. So these participants were considered to be the future implementers. However, we still noticed that across other focus groups, other stakeholders were not aware of SIHI. The second finding I found is that sometimes there was limited comprehension or familiarity with the processes or concepts which were introduced during the activities. For instance, this quote, which was mentioned by one of the external evaluators, mentioned that general knowledge in health systems and equity provides more credibility and allows for better probe into the question. So to give more context, this was again in the pilot testing of the equity tool. The external evaluator mentioned that if they had more background with it when it comes to health systems and health equity, then it would have allowed them to ask better questions to really dive deeper into the activity itself. However, I think that this lack of awareness or even this limited comprehensibility shouldn't be interpreted as something negative. On the other hand, I think it created an opportunity for learning as well as stimulated curiosity among the participants. And this is clearly illustrated by this quote. The participants realized how important equity considerations were because they never thought about them when doing the project. How to improve their own operations and progress factors became a point of collaboration. So this quote clearly illustrates that this lack of awareness or this limited understanding pushed the participants to ask more questions and to learn further about SIHI and their work, as well as to potentially form collaborations with them in the future. All right, for the second theme, it's about the availability of resources. So it's quite self-explanatory on its own, but one of the subconstructs that I found was namely funding. Of course, funding is one of the most crucial and essential resources for the development as well as scaling up and sustainability of social innovations. So of course, it's not a surprise that a lot of social innovations went to SIHI to ask whether they could fulfill this role of providing financial assistance for the implementation needs. The problem is that SIHI has limited financial capacity, which means that most of the finances that SIHI has are internally spent, so for salaries and their own activities. So it's difficult for them to provide that financial assistance. However, what they do is they play more of an intermediary role. And what this means is that they connect the social innovators to other potential partners or research grants or governmental grants, which are able to fulfill this role. So this is something that the hub primarily focuses on as being an intermediary. However, SIHI also has to think about its own long-term sustainable financial sustainability because recent internal meetings that occurred with TDR, which is one of their main funders, have revealed that there will be budget cuts in the future. So this is something that the organization has to think about. But they have, when I spoke to them, they did explore other funding avenues, such as through outreach or even through institutionalization, because if there's not enough funding, this makes it difficult to clearly state some of SIHI's goal. The question now is, are these efforts going to be sufficient in order to deal with this? All right. Now, there are other resources that also emerged through my observations, which were namely human resources, time, and materials and equipment. So human resources refers to the organizational capacity of SIHI. And in this case, they are they are operating with quite a small team that is responsible for managing different projects simultaneously. So this can sometimes be difficult in order to write proposals on time because some of the work can be very burdensome, or even make it difficult for them to take the lead in some projects. In terms of time, we see that in some scenarios revealed that some activities are quite lengthy and also are quite uncertain. For instance, I'm going to give the example again for the focus group discussions. The recruitment of participants can sometimes be uncertain because the recruitment is dependent on the innovators themselves. So from the observations here, I noticed that the stage of the innovation here is also important. So an example here is the social innovation AHA, the behavioral design, as you can see on the slide. This was an innovation that focused on creating nudges to improve the mental well-being of medical professionals during the pandemic. And the problem was that they had lost track of its end users because the social innovation was not implemented anymore because, so quote, the pandemic ended, right? So this is a clear example of sometimes how SIHI cannot really be in control of how long certain processes can take, and this can create unforeseeable events. Then for materials and equipment, SIHI has offered and mentions continuously throughout its activities the availability of open access resources on their websites and also distributes them during their activities. One example here is the launch of the Global Health Network Country Hub, which I was lucky enough to partake in. And this was launched on April 21st. So here you can see a picture of the online meeting. And this is basically a national initiative that tried to bridge Filipino academic institutions together with the global health research community. And SIHI was able to bring together a platform in which different institutions that engage on global health work were connected together, and it allows for a better bridge between the global network together with the Philippine network. All right. So for the third theme, it was about the receptiveness of the activities by the innovators and stakeholders. So as you can see on the slide, the activities prompted different reactions among the participants, right? So some of people thought it was very comfortable, others were passionate, others found it rewarding, motivating, engaging, natural. Some were distracted, of course, others were defensive, which can happen. These engagements highlight the extent to which some of the activities are either acceptable or appropriate in the context. So what I refer to acceptability, it refers to the perception among innovators or even implementers of whether SIHI work is acceptable or satisfactory, right? And most activities were responded in a very positive note by the participants. They often use words such as helpful or beneficial to describe the activity. It also highlighted the importance of community involvement as well as strengthening capacity building within their communities. And here in this picture, for, the one down below, it illustrates a journey mapping exercises which was done by one of the participants. So this is a co-creation method that was introduced to participants in the context of a community skin health program. And in this case, the participants, which were mainly medical professionals or medical students, they had to envision the journey of their patients. So from the onset of the symptoms of a skin problem towards them having to seek care. So this exercise really allowed the participants to envision what is the journey that their patients have to take, right? So they had to list the different actions that they have to take, but also the emotions that the patients have to go through, the environment, and so on. And I really like this illustration, this quote, which I'm going to read right now. So a participant mentioned that when they were doing the journey mapping, going through the experience of the patient and the symptoms and consultation, they realized how they could improve each of the phases they went through as a healthcare provider. They were able to recognize what improvements were needed. So this quote clearly illustrates the direct impact that the human-centered design workshops had on the participants' day-to-day work, because they were able to envision themselves a different perspective when it came to delivering care. And some of the cultural aspect that I mentioned that I noticed, especially as someone not being of Filipino ethnicity nationality, I noticed that there's a certain credibility already given to the SIHI members. So the SIHI members are mainly composed of doctors, and this seems to be quite valuable among the community members, which allows to already establish a certain mutual trust between the professionals and the community members. I think Filipino culture generally is also very open and friendly, so it allows to introduce like new concepts more easily, and there seems to be more open to new ideas when it comes to incorporating that into their day-to-day work. There's also seems to be a general willingness to help one another, so this solidarity. And generally, activities are seen in a very engaging and lightheartedness. So they are very engaged with the activities, but at the same time, they have fun during those activities, which is very nice to see. All right. So the different activities can also have an impact with regards to the appropriateness, right? So most participants describe the activities to be appropriate as well as useful for their day-to-day work. However, there were some concerns that were expressed. This was also mainly during the context of the pilot test of the equity tool, which was with regards to participant incentives, suitability of the target group, the length of administration process, as well as the innovation stage of development. And I want to dive deeper into this last one because the equity tool, one of the requirements was that the social innovation had to be implemented for at least a year, right? But when we piloted that tool, there were some social innovations that had not been implemented yet. So there was a part of the tool that they couldn't respond to. So this questions, of course, the appropriateness of the activity because it didn't fit the tool's requirement. However, this is still normal to see as the tool was still in its pilot stage. So the hub acknowledged these limitations and they introduced follow-up meetings in order to document this and to address them and make the necessary adaptations to it. All right. So the role of the hub in forming connections and partnerships across the ecosystem was really well documented. So a wide range of individuals and organizations were engaged throughout. So for instance, existing but also new social innovators with their end users were reached, external partners, programs, SIHI hubs, governmental actors, the private sector, and academic institutions. And here again, there was an illustration from my observations. So SIHI participated in a 3-day workshop in which different stakeholders participated, so including the private sector, the healthcare professionals, and healthcare students. SIHI took the opportunity to participate in the workshop to promote its work and present an innovative service that reflected its values and activities. The lead manager was actively explaining and promoting the hub's work to new stakeholders as future potential collaborators for partnerships. The innovation presented by SIHI won the workshop's competition, showcasing an interest in the work of SIHI. And in my previous slide, this was the part of the workshop. So this was Bagwiz, the idea that SIHI came up with and that won the workshop competition. Yes. So this is a clear example of how SIHI actively promoted its work through this activity. It also highlights the importance of networking because it allows to enable collaboration not only across borders, but it allows to leverage expertise. So sometimes other stakeholders have more experience with regards to a health topic, so it allows to do that and also to expand the reach of SIHI. So here I presented 2 examples. So you have Nora Health, which is a social innovation in India, which provided a list of potential partners that SIHI could work with. So this is a great example of how connections are important, right? Also, existing social innovations, they provided SIHI with a list of other social innovations that could potentially be useful for the focus groups discussion. So these are some examples of how connections and partnerships are advantageous. But of course, within connections and partnerships, there always are challenges, right? So sometimes there can be competing interests, but also uncertainties around leadership and task allocation. So here we see two quotes. The first one mentions, "It is frustrating to always have to look for funders, and funders also have their own agendas that can clash with content and project themes. So they have different priorities, communities, and locations." So here it really shows how it can lead to frustration sometimes among SIHI if they're constantly working with funders who, of course, have their own agenda. And then the second quote mentions, "The consortium was put together by WRI, which was another stakeholder. SIHI did not know that they would be the lead already and had a strong idea at the start about taking the lead." So here we see another scenario of when SIHI was collaborating with another stakeholder, that this other stakeholder wanted to take the lead in the project, which sometimes can be difficult to deal with when they already have such a strong idea of taking the lead in that case. All right, for the final theme, it's about the support for innovation development. So the hub actively contributes to the sustainability of its activities through maintaining contact with its social innovations, through the institutionalization of SIHI, because SIHI is currently a program under the Department of Clinical Epidemiology, but they're currently working towards being their own institute. So this really helps with their long-term sustainability as an organization. And they also work on the capacity building efforts within their communities, as well as contributing towards policymaking and law. So here is an illustration again. So SIHI wants to institutionalize itself within public structures to ensure its sustainability as it establishes its role as a linkage between different actors within the social innovation and health ecosystem. So here we clearly see how SIHI is able to contribute towards reaching different actors throughout the ecosystem. And then I wanted to dive in deeper as well into the policies, laws, as well as memorandum of agreement. So, of course, these are particularly useful when it comes to supporting the work of the hub as well as the innovators. But one of the things that is missing so far is that SIHI doesn't really have a dedicated policy or a legal mandate that is supporting its role. Unlike other programs, such as the program of health promotion in the Philippines, they do have a dedicated policy. So one of the things I was brainstorming is that why doesn't SIHI collaborate closer with this Department of Health Promotion if they also want to push forward their agenda? Because I think SIHI as well as health promotion have a lot of different activities in common. So this can something that SIHI could use to for their own leverage. But I think that potentially SIHI has already looked into this, if I'm not mistaken. Another advantage of SIHI is that they convene local governments in most cases, because the healthcare system in the Philippines works within a devolved system, meaning that most of the decisions are at the local government level. And in many scenarios, SIHI works closely with local governments to set up memorandum of agreements for its activity. So this is a clear example of how they're able to bridge these national level gaps through policy support, particularly through local level engagement. But as we know, policies, laws, and memorandum of agreements do not always guarantee effective implementation, right? And this was exemplified in the SEA-DREAM program, which is a multi-country initiative throughout Southeast Asia. But that they can be policies, but implementation will always remain a challenge. So this showcases, of course, that only relying on policies or legal instruments is insufficient in order to ensure the continuity or the effectiveness of its efforts. Then we have the organizational embeddedness in bureaucratic systems. So, of course, on one hand, operating within public academic institutions provides the hub with the structural stability, right? That supports its long-term sustainability within national systems. But on the other hand, this positioning also means that SIHI's ability to influence the work and implementation of its social innovation is shaped and at times constrained by the bureaucratic processes of the government or academic institutions in which it is embedded in. So these bureaucratic requirements can lead to like delays or even slow down processes or even hinder the access to resources. So in some cases, the resources were there, the money was there, but SIHI could just simply not access it. And then finally, it can also create additional administrative burdens upon SIHI. And here I included a quote which was illustrated by one of the social innovations, Alagaka, that SIHI works with. So some issues in the translation of the winner's grant prizes under DOST BCHRD, which is from the government. They do not want to work with DOST anymore due to requirements and hard to get grants. So even though they won the grant, it was difficult for them to continue further with accessing those resources. Then other ways that the hub supports innovation and development is namely through coordinating and planning. So they put a lot of effort when it comes to adequate preparation, but also convening different stakeholders, as well as delivering the work within deadlines. So in some cases, there are logistical limitations that arise, for instance, with the DOH Ahead program, which is the governmental program, sometimes reaching sites other than Manila can be difficult. So these are some logistical issues that sometimes arise through observations. But in general, SIHI has demonstrated a lot of adaptability and flexibility, particularly to the context that they're working in, but also to the stakeholder needs and their requirements. And there's generally this continuous improvement as well as iteration in their activities that they conduct. All right, so these were my key takeaways, which were reflected within these 5 themes that I had identified, which were namely communication, availability of resources, the receptiveness of the activities by the innovators and stakeholders, connections and partnerships, and support for innovation development. All right, so the second thing I did want to mention was the ability of the hub to maintain this engagement with various individuals and organizations in a very complex and evolving system. So even though there were some miscommunications that arise at times, again, I wanted to stress that the hub has been able to demonstrate this adaptive nature. So they are continuously integrating feedback mechanisms after the activities that enable the continuous improvement of their activities over time. So through this adaptability, the hub is able to maintain a very tailored approach to the diverse context, as well as prioritize the needs of its stakeholders and end users. We also don't have to forget that social innovations can be very complex, right? So they involve different actors, there's evolving responsibility. The project timelines sometimes shift over time, especially when the innovations are developing and growing. There can be turnover or even expansion of the team members, and this makes it sometimes difficult to have this consistent engagement with them, right? So the question really is about how SIHI is going to navigate those transitions and keep this engagement with them. So there's a clear need for collaboration as well as shared responsibility, because of course it's not only the hub's responsibility to always stay in contact with the social innovations, but it's also their responsibility to keep that engagement going with them. So there needs to be coordination as well as continuity and clear communication of the connections and partnerships there. And SIHI has tried to approach this through Innovex. Innovex is a learning exchange program where different social innovators can be in contact with each other and also share best practices about what has worked in their cases. And this was able to bridge or help with this consistent engagement. But from what I last heard, I think Innovex has been halted. So maybe think of an alternative to Innovex or working with Innovex again might be something to consider for SIHI. Then I also wanted to highlight the hub's advantages again. I think one of the main advantages is that it's integrated within its public institutions and is currently working to becoming its own institution, meaning that this really allows to help for the long-term sustainability of SIHI. SIHI acts upon the policies and legal mandates, particularly at a local governmental level. They are active they're very active when it comes to connecting and convening different actors and organizations within the ecosystem. And lastly, they are strong advocates for the work that they do. So they continuously, throughout all the activities, are introducing what SIHI does and what their advantages are. And of course, I wanted to share some of the recommendations which I think can be quite valuable for SIHI. So the first one is obviously about this coordination as well as ensuring that there's sustained engagement between the innovators and stakeholders throughout time. The second is about collaborating with other programs which have this formal policy back-in, like I mentioned with the program of health promotion, which have this dedicated policy. So maybe acting or working with this program can be beneficial. The third recommendation is to expand collaborations, perhaps to other sectors, because I think SIHI mainly focuses on the public sector. I think that trying to explore like the private sector more, or even marketing firms for SIHI can be quite beneficial, as well as diversifying dissemination channels. And then lastly, I think for when it comes to the long-term financial sustainability, it's important to look into what are concrete actions that SIHI can take in order to ensure this funding for the organization. Yes. I also wanted to highlight what the value was of becoming a SIHI intern in the context of a Master's of Global Health. I think it was an incredible opportunity. I'm very happy because I got the opportunity to learn about concepts of social innovations in health. Like I mentioned, I didn't really know what social innovations in health were at the beginning, and you also get the opportunity to apply them to real life, to community. So that was definitely very insightful. You get hands-on experience in global health, especially in the context of low and middle income countries, because you have to navigate all these different structures, which are completely different if you come from a high income country. So that was also very interesting. I also got to be involved directly with the communities themselves, and it strengthened my cross-cultural competencies because I didn't have much of a background of Filipino culture, so I learned a lot about how things operate there and how community work looks like in the Philippines. And then also I got to apply some co-creation methods. So I got to deliver and facilitate a workshop on human-centered design, which I think was probably my highlight of my stay there. And of course, I wanted to mention the food because it was very worth it. I got to try different things. One of the images shows banana ketchup. So I don't know, maybe it's worth going to the Philippines just to try that. But in general, it was very delicious. And also, I want to thank the SIHI team for making my stay as welcome as they did because they were so helpful with everything, and I think it was just a great team to work with, and I hope to work with SIHI in the future if our paths align again. So yeah, this was it for my presentation. So I just want to thank everyone for listening, and if you have any questions, please feel free to mention any now in the Q&A. And I've also included my email and LinkedIn here in case you would like to connect with me. Thank you.
Thank you, Nisha. I think we have one question from Pam.
Yes.
So, among everything you've experienced through the internship, what can you recall as the most enjoyable? How about the most high yield or educational experience?
For me, the most, I think, educational experience was facilitating the human-centered design workshop because it allowed me to have direct experience with what human-centered design workshops are. I got to learn more about the concept itself. I've never used that before in my educational path, so I got to learn a lot about that, and I got to apply it directly to the community. So seeing that shift as well in the participants was, I think, was most important for me to see that we were able to provide a new perspective to them and that it has a direct impact on their day-to-day work. So I think that was definitely my highlights. Yes.
And we have a couple more questions. Another one from Doc Hannah. So, based on your observations and reflections, what key activities and approaches should the hub keep as it is minimum viable product given that resources continue to dwindle and we may not be able to do as much as we have been doing or as much as we want to do?
And I think that's a really good question. I think the hub can continue by working on its advocacy efforts. I think that's something that I've observed throughout, that you're always introducing what the hub does and how they're able to contribute towards research and connecting the innovators with research grants. So that is something that I would focus on as a hub with all the financing constraints so far. And for instance, the workshops with Siemens, for instance, allowed for a great opportunity to connect with the private sector, which I think can provide a lot of opportunities to explore different funding avenues for SIHI. So that's something I would, recommend.
And then another question, how will your experience shape your plans for global health, whether programmatically or research-wise?
Sorry, can you repeat that question?
So how will your experiences here in SIHI Philippines shape your
Mhm.
plans for global health, whether programmatically or research-wise?
I think, I think it will shape my plans in terms of diving into community work and being also a strong advocate for that. I think for me, it was very inspiring to speak with the CHI team members to see how strongly you talk about community engagement and also to see the impact of it. And that inspires me to do the same, that just with community engagement or just by talking with people, you're able to really create a change. So that's something that I will keep forward in my career and also be an advocate for.
And I think we have the last question in our chat box. So, what is your key takeaway in doing community work in the Philippines given the CHI context?
I think my key takeaway is to always listen first to what they have to say, and that no idea is ever stupid or out of the box, that every belief or every saying that they have matters. I think my discussion with Meredith, where she mentioned that the community preferred to have a fiesta over health education, was very insightful to take a step back, to always understand why is that important to them and how can we, through that, share the importance of social innovations in health. Yeah.
And I think personally, a last question from me. So, how has this internship changed your understanding of community? Like, I guess from the same from the last question, understanding of community engagement and social innovation in health compared to what you have usually learned during your master's or your PhD classes.
That's a really good question. I have to think about that. Um, Yeah, I think that what's inspiring is probably the methods that SIHA use, because I wasn't familiar with them before and they haven't been introduced to me during my educational path. So learning more about that social innovation aspect and how you can work within different disciplines to really push forward community engagement, I think that was something valuable of this experience that I will, yeah, keep with me in the future.
Okay, thank you so much, Nisha. So, before we officially conclude today's program, um, it is my pleasure to invite Doc Medit for our closing remarks. So to share a few words and reflections on today's discussion. So, Doc Medit, the floor is yours.
Thank you, Mitch. And of course, good day to everyone. And thank you, Nisha. It was a very inspiring and insightful presentation. It's good to see you again.
It's good to
And I
see you.
think our congratulations are in order. I received an invitation from your university for your graduation this October. So, of course, we're so proud of all
Thank
your
you.
achievements. And
Thank you.
thank you for sharing that because I think it's from time to time, it's really good to have an external perspective from the work that we do, not only here in the Philippines, but as a global network. And we like to thank TDR, of course, for connecting us with you, for the information of everyone. We're also asking Nisha where she heard about social innovations, and it turns out she's been listening to podcasts in TDR, and her interests really are on community engagement and sanitation and these programs. So that's why she was referred to us here in the Philippines, and that has been a very good partnership and collaboration. So we had to thank TDR for bringing Nisha to the Philippines, and of course, looking at and hearing all the sharing in how many slides in such a very short time. Nisha arrived in the Philippines on the first day of February until end of April. That's a very short time. We were in between
Welcome to Voice.
projects and the things that we were doing. It was very challenging given the location of all the SIHI members. We're not located all in Manila because it's also with the nature of what SIHI does. And of course, you've heard of the many challenges in terms of resources and other things, policies. But I think that's the heart of innovation. People become creative and innovative out of necessity. And when there's rocking of the boat, people are pushed to think outside of the box. So that's also one key learning that I think we've seen all throughout our work in social innovations. But indeed, listening to the community, it's a very, what you call this, a humbling experience, both for learning, relearning, even unlearning the things that we have learned before, which we thought were actually working, but in reality does not, especially if you put it into context with what the community knows already. So thank you, Nisha, for putting all of this into words and also highlighting what SIHI Hubs does. So the SIHI Hub in the Philippines is just one example in the network. I think we do common things like working with communities and connecting social innovators to partners so that their work can flourish, their work can scale up, and their work can be sustained. And it's most of the time very, very challenging. But I think that's the heart of social innovation when, there's all things that are worthwhile doing are not easy. So that's why we need to be in a network or to be in a partnership. We need to come together so that all this, even if it's difficult, we can continue what we need to do as a community, as a people. And I think Nisha also mentioned Innovex, and I'm happy to share that next week during the TUFH Towards Unity for Health conference, where UP Manila and SIHI and TDR are co-hosting here in Manila, we will be relaunching the Innovex, this time at the global network. So yeah, that's a very important platform because this was co-created by a lot of stakeholders here in the country. This was funded by the Department of Science and Technology. So now we're actually repackaging it, not just as an Innovex, but even trying to coin a term, Globex. So it's going to be Global Impact Exchange. So we hope that it will really be shared. And the other thing is, Nisha also mentioned about policy and sustainability. I think that's also very important. But we're thankful also in the university. We have the support of the university. We have already almost there, becoming an independent institute under the National Institutes of Health in the university. We have just been informed that hopefully by the next month, in the next Board of Regents meeting, the institutionalization is already part of the agenda. So the Board of Regents is the highest decision-making body in the university system. So we hope that we'll get that approval. I think this will also facilitate making SIHI, expand in terms of visibility, not only in the country, but also globally in terms of its platform, in terms of its support, and hopefully really a policy of its own. And we're working also towards that. So we're now partnering with the Department of Health. So one exciting project that we did hope that Nisha would have been able to join, but it's just been approved recently, but hopefully implemented this year, is what we call CoLab. So this is now with the Department of Health. So it's also looking into strengthening social innovations partnership at the local level. So I think these are the things that have been brewing and going on. And it was really fun to have Nisha here because if you all know together, you have the same context, you have the same culture. Sometimes we already understand really each other, but to have Nisha with us, she looks at things with a different perspective, with fresh eyes, with a non-Filipino eyes, although that's correct. She's always mistaken as a Filipina. People would talk to her in Tagalog because she looks like us. Only she's taller, but she really looks Asian. But it's really helpful to have an external perspective. And yes, Nisha, you are very much welcome to go back to the Philippines, if only for two things, for the team and for the food. You're very welcome to come back. And we do hope, as Hannah said in the chat, that in the future we can have collaboration again with you. And who knows, the social innovation ecosystem is a very small world. So we hope that we'll bump again into each other to collaborate in future programs and projects. So with that, I would like to thank everyone who's here listening in. And we hope really that what Nisha shared has been also very helpful for you. So do partner with us. If you think the work of SIHI is also relevant to what you do, we can co-learn and co-create things together, especially for our communities. So thank you very much. And in behalf of the SIHI Philippines team, and we will be having a SIHI Summit, which will be attended by the Global Network next week. So that's happening on Monday, Tuesday, Wednesday, Thursday. So we do hope that it's going to be hybrid. I hope we'll be able to share for those who are coming to the Philippines. We are excited to have you here with us, but it's also hybrid. So we hope we will be able to share also the link to those who are interested, only for the SIHI Summit part, which is happening on the third day of the conference. So thank you very much, and we hope you'll have a very productive and fruitful day ahead of you. And again, Nisha, our warm congratulations from the whole SIHI team.
Thank you so much, Dr. Meredith.
Okay, thank you everyone. So as we come to the end of today's SIHI Talk session, I would like to extend our sincere thanks to everyone who joined us today, both here on Zoom and through our live stream. So a special thank you to Nisha for sharing her reflections and valuable insights from her experience as an intern here at SIHI Philippines. So before everyone leaves, we invite you to complete our post-evaluation survey by scanning the QR code on our screen. Your feedback is very valuable to us, and you will also receive a certificate of attendance after the survey. So if you would like to revisit today's discussion or catch up on previous SIHI talks, recordings will be available in our SIHI YouTube channel. And once again, thank you for being part of today's conversation. We hope to see you again in our future SIHI talks.